Hello, I'm Dr. Jane Taylor, and today for you, a mature man over 50, 60, or beyond, I bring an essential conversation about your masculine health. Let's demystify a topic that many think about, but few feel comfortable discussing openly, even with their doctors: ejaculation frequency. Is it a benefit or a risk for your prostate? Society has taught us to stay silent about this subject, treating it as something for teenagers or harmful in a more advanced stage of life. However, science, with its objectivity, has been showing that the frequency with which a man ejaculates, whether through masturbation or sexual intercourse, can have significant and measurable impacts on prostate health, especially as we age. So the big question we'll answer today, based on solid evidence, is straightforward. What is the balance between a practice that can be proven healthy and an excess that can, indeed, cause harm? In this video, our mission is clear: to separate fact from fiction, unravel prejudices, and provide you with pure, reliable knowledge. I'll show you what recent research, including studies from major universities like Harvard, has discovered about the relationship between ejaculation and prostate health. By the end of this information journey, you'll have the clarity and confidence needed to take care of your masculine health in an informed, proactive way, and most importantly, without any embarrassment or guilt. If you truly want to understand how such a personal habit can be a powerful ally for active aging, with quality of life and preventing potential health issues, stay with me until the end. To never miss any of our valuable future information that can transform your health, click subscribe below and turn on the notification bell to be notified of every new video from Male Secret 60 Plus. To start, it's essential to understand what the prostate is and why it becomes such a critical focus as we age. Think of it as a small gland, roughly the size of a walnut or chestnut, strategically located just below the bladder and surrounding the urethra, the vital channel through which urine passes. Its primary and fundamental function is to produce prostatic fluid, an essential component of semen that nourishes sperm and gives them the mobility needed to fulfill their role. As the years go by, the delicate hormonal balance in men, which was constant for decades, begins to change. Testosterone, though still present and active, starts to be converted into a biologically more potent and active byproduct called dihydrotestosterone, or DHT. It's this DHT that acts almost like a fertilizer for prostate cells, stimulating their continuous and, in many cases, excessive growth. This natural process of male aging leads to an extremely common and benign condition called benign prostatic hyperplasia, BPH. It's crucial to emphasize and repeat: it's not cancer. However, the problem arises when, as it grows, the prostate presses on the urethra, acting like a ring that becomes too tight. This causes those symptoms that, unfortunately, affect the quality of life for many men: hesitation to start urination, a weak and often interrupted urinary stream, the uncomfortable sensation of incomplete emptying that makes you return to the bathroom minutes later, and most commonly and disruptively, nocturia. The need to wake up several times at night to urinate, fragmenting your sleep and compromising your rest. The statistics are clear. By age 60, about 60% of men already experience the effects of BPH to some degree. By age 80, that number jumps to nearly 90%, making it an almost universal condition. This is where ejaculation frequency comes into our discussion and becomes a point of vital interest. Many men report in consultations that an active sex life seems to alleviate these prostatic symptoms. But is this just a subjective impression, or is there solid scientific evidence behind it? Let's examine the 6 main benefits that science has discovered and proven, transforming what was once taboo into relevant health information. First, the fluid renewal of the prostate. One of the most robust and widely accepted theories is that of fluid stagnation, The prostate is constantly producing and storing its fluid. If there's no regular renewal through ejaculation, this fluid can stagnate. Over time, this stagnation can lead to the accumulation of old secretions, dead cells, and, more concerningly, potentially irritating substances. Ejaculation acts as a true internal cleansing, regularly expelling this accumulated material. A high-impact study from Harvard University, which meticulously followed over 30,000 men for nearly 2 decades, reached a surprising statistical conclusion. Men who ejaculated 21 times or more per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times. The hypothesis is clear. By keeping the gland in constant renewal, you significantly reduce exposure to inflammatory factors. Second, improved pelvic circulation. Think of it as a high-impact, localized exercise for your pelvic region. Sexual arousal and orgasm cause a significant and temporary increase in blood flow to the entire pelvic area. This oxygen and nutrient-rich blood irrigates not only the prostate, but also the bladder, the nerves crucial for urinary and erectile function, and the pelvic floor muscles. This true vascular workout helps maintain optimal tissue elasticity, improves nerve function, optimizes responses, and strengthens the muscles that control both urination and erectile function. Keeping this area well oxygenated, irrigated, and toned is absolutely essential for long-term health and preventing dysfunctions. In third, stress reduction and hormonal regulation. Orgasm is, without a doubt, one of the most powerful and beneficial neurochemical events the human body can experience. It triggers a cascade of positive hormones and neurotransmitters, such as dopamine, the reward and pleasure hormone, endorphins, our natural painkillers, and oxytocin, the famous bonding and well-being hormone. At the same time, it actively reduces levels of cortisol, the dreaded stress hormone. Chronic stress is a known and proven trigger for inflammation throughout the body, and the prostate, unfortunately, is particularly sensitive to it, potentially leading to a painful and uncomfortable condition like prostatitis. Thus, by using ejaculation as a conscious tool for relaxation and tension relief, you're actively combating systemic inflammation and improving your prostate health holistically. Fourth, maintenance of libido and brain function. Sexual desire doesn't reside solely in the genital organs. It actually begins and is intensely modulated in the brain. Libido depends on a complex and intricate neurohormonal feedback cycle. Regular sexual activity, or masturbation, keeps these neural pathways active, responsive, and fully functional. It's a clear signal to the brain that sexual function is still relevant, helping to preserve interest, desire, and sexual vitality. Going without any kind of stimulation for long periods can make these neural pathways less efficient, making it much harder to reactivate desire and sexual response later in life. Fifth, preservation of erectile function. The health of the male sexual organ depends directly on the health and integrity of its internal tissues, the corpora cavernosa. Erection ensures that these tissues are regularly filled with fresh, oxygenated blood. Without frequent erections, this essential tissue can undergo a process called fibrosis, where it loses its natural elasticity and becomes stiffer, making it harder to achieve and, crucially, maintain a firm and satisfactory erection in the future. It's the universal biological principle of use it or lose it. Regular ejaculation acts as a kind of physiotherapy, a preventive maintenance exercise that preserves tissue health and, consequently, erectile function. Sixth, induction of deeper, more restorative sleep. Sleep quality is one of the non-negotiable pillars of overall health, especially after age 50 or 60, when sleep patterns tend to change. The combination of deep post-orgasm muscle relaxation and the release of hormones like prolactin creates a natural and deeper state of drowsiness. For men struggling with persistent insomnia or whose sleep is already frequently interrupted by unwanted nighttime bathroom trips, using ejaculation as a conscious and relaxing pre-sleep ritual can be a powerful, natural, and effective tool to significantly improve rest quality. Now, it's crucial to address the other side of the coin: the risks of excessive or compulsive practices and the myths that still stubbornly persist. The benefits I mentioned apply to a healthy, conscious, and balanced practice focused on well-being. The real problem arises with compulsion and imbalance. The first risk is dependency on adult content, pornography. Excessive and uncontrolled consumption can desensitize the brain's dopamine circuits. This means the brain gets used to hyper-intense and often unrealistic stimuli, making real intimacy less exciting and, dangerously, potentially leading to difficulties with sexual response in real and meaningful situations. The second risk is physical prostate irritation. While regular ejaculation is beneficial, excessive stimulation, done too vigorously multiple times a day, can indeed cause mechanical inflammation. This can lead to an uncomfortable condition called congestive prostatitis, which causes pelvic pain, burning during urination, and generalized discomfort. Third, fatigue and energy depletion. Ejaculation is a physiological event that, like any other, consumes the body's energy resources. In older men, the body's recovery capacity is naturally lower. Excess can lead to a persistent feeling of physical and mental exhaustion, lethargy, and a noticeable drop in energy and disposition. We also urgently need to debunk persistent, baseless myths. Science does not in any way confirm that ejaculation causes cancer. On the contrary, as we've seen, major studies suggest it may help prevent it. It doesn't permanently deplete testosterone, only temporary